Now, how do you spot a sociopath? When you talk about a sociopath, one thing that comes to your mind is a liar. Telling lies comes naturally to a sociopath. They don't feel guilty about lying. You see, many people, when they lie, they feel guilty. But a sociopath, they will lie as they look at you, eyeball to eyeball. They look at you straight into your eyes as they tell you lies. Sociopaths can tell you outrageous lies and truths without any remorse, without any guilt, without feeling any remorse. A sociopath will lie to you about everything, about anything. They lie to you about their relationship status, their marital status, that is, their job, all right, their family, their past, their present, their friends. They will lie to you about everything. Sociopaths, definitely they have many reasons for lying. And one of the biggest reasons for the sociopath lying to you is because they want to manipulate you. They love manipulating people to do what they want. But many sociopaths still will lie because they just feel nice, they feel good, they feel thrilled, excited just by having that habit of lying. So when you catch a sociopath lying, they will lie much more. They will invent more lies to cover that one lie. So that way it becomes very difficult to untangle the narcissist's lies, their web of deceit, their cheating behaviors. So, a sociopath, if you want to spot a sociopath, watch out for manipulative tendencies. These people have a skewed conscience. They don't have a normal sense of right and wrong. And a sociopath is highly manipulative. They are master manipulators. They will manipulate you. They'll mislead people so that they get what they want without considering how it makes these people feel, how it makes their victims feel. Now, the sociopath will manipulate you by taking advantage of your sense of pity. They take advantage of your empathetic side. They make you feel guilty. They are very flirtatious. They'll flatter you. And they will fake an empathetic personality just to manipulate you some more. So, if you want to spot a sociopath, ask yourself, are they short-tempered? Are they moody, irritable, easily angry? You know, irritability and aggressiveness are common traits of sociopaths. And that's why sociopaths quickly get into physical fights. They quickly get into assaults. And a sociopath don't forgive easily. They don't forgive easily. A small misunderstanding, a small slight on a sociopath, they don't forgive you. Sociopaths, they think that they are superior to others. They believe they're above laws. They believe they're above rules. To the sociopath, laws, rules, unspoken rules of politeness, for instance, and other common conventions do not apply to them. But the sociopath will pretend to observe social norms in situations where they think it will benefit them. Now, Is that partner of yours, that friend of yours, impulsive or hedonistic? Are they selfish? Are they egocentric? Now that is another trait of a sociopath. They are self-centered, and they usually don't feel fear or anxiety to the same degree that other people do. So they live according to their whims. It is all about them. They do what feels good to them in the moment without thinking about the consequences of their actions. They only care about their needs. They are irresponsible at spending. They have risky sexual behaviors. They drive carelessly. All these are impulsive behaviors that sociopaths engage in. Now, if you have a partner who cheats on you, and they do that because they accuse you slept with someone else, and that's why they were upset, and that's why they slept also with someone else. This is clearly a sociopath. They have this rash decision making for instant gratification. They don't care about consequences. That is sociopathy. Many sociopaths are very charismatic, but they lack empathy. They do not feel emotions the same way most other people do. But they are very talented or skilled or smart at mimicking displays of feelings and creating the illusion of connection, rapport with other people. These are the people who shed tears to show that they are caring, that they are remorseful, that they are guilty, or that they are sympathetic. This superficial charm that the sociopaths have helps them get their way. As sociopaths, they lack empathy. They have limited ability to feel other people's pain or happiness. So, in short, the sociopath rarely feels remorse or guilt for doing things that hurt other people. They are able, or they may be able to put on a convincing display of empathy if the situation calls for it. So, due to these sociopaths' well-developed social skills, most people have a hard time recognizing that such displays of emotion are fake. Now, the midlife crisis. What is midlife crisis? Let's start by defining midlife crisis. It is that period of transition in life where someone struggles with their identity and self-confidence. Midlife crisis can happen anywhere, mostly from about 40 years old to 60 years old. And this crisis affects both men and women. Let's be clear about it. Midlife crisis is not a disorder. It is merely psychological. Midlife crisis occurs when someone looks at where they are in life compared to where they think they should be by a certain age. You start asking yourself, I should have been at this stage of my life, not here. That's where problems start. You start comparisons. So, this midlife crisis is defined as that period of emotional turmoil in middle age, that is 40 to 60 years old, characterized by a strong desire for change. While navigating change is an inevitable part of the human experience, middle age can bring unique life transitions, unlike earlier and later phases in life, including an increasing awareness of mortality. It is said that this phenomenon of the midlife crisis is described as that psychological crisis that is brought about by events that highlight a person's growing age. inevitable mortality, and possibly lack of accomplishments in life. I want to stress that word, lack of accomplishments in life. So this midlife crisis may produce feelings of intense depression, remorse, high levels of anxiety, or the desire to achieve youthfulness, or make drastic changes to their current lifestyle, or feel the wish to change past decisions and events. So when I say midlife crisis starts between 40 and 60 years, hey, a few years to 40 years and a few years above 60 years, still that is part of the midlife crisis. Now, one common belief about this midlife crisis is that you should expect to face inner turmoil about your identity, about your life choices, and about mortality. The severity of midlife crisis can vary from one person to the other, from person to person. Gender can also play a role in how a midlife crisis unfolds. You know, women may be more likely to go through a period of self-reflection when they shift away from tending to do the needs, from tending to care for the needs and doing the needs of others to caring for their own needs. Men, on the other hand, might be more likely to feel as if their past decisions have limited their future options. Sometimes it can be confusing to know if you are feeling depressed or if you are experiencing a midlife crisis. You see, the depression, the midlife crisis is confusing. You don't know which one you're going through. But both the midlife crisis and depression have similar symptoms and they can be confused with one another. A midlife crisis happens periodically and may last for a short time. Depression will last much longer and it may be more consistent. But in either way, both the midlife crisis and the depression, both conditions can be emotional and confusing. And that is why it is good to look for help. It is good to look for advice. And even the reason why you're watching this video right now may be one of the reasons why maybe you suspect you are undergoing depression or midlife crisis. So, how do you know if you are experiencing a midlife crisis? In short, what are the signs that you are going through midlife crisis? Number one, deep sadness and regret. Do you find yourself ruminating over perceived missed opportunities in relationships or employment? This leads to a deep unhappiness with the present and a tendency to overlook the good aspects of your life. So, feeling sad or lack of confidence, especially after a big milestone accomplishment or after a birthday, is a big symptom of midlife crisis. You feeling bored, loss of meaning or purpose in life, feeling unfulfilled, feelings of nostalgia, excessively thinking about the past, making impulse actions, feelings of regret, constantly comparing yourself to others. Now, midlife crisis in women can be worse because of menopause. In men, emotions may be more angry or irritated. Okay? There is this feeling of restlessness and daydreaming. You might feel bored or exhausted with your daily routine. You see, whether that includes your work schedule or other responsibilities. You start daydreaming about what life would be like if you had followed a different career path or if you had married a different partner. So, the desire for change can make it hard to focus on what is in front of you. The other symptom of midlife crisis is irritability. You feel like your past decisions have boxed you in or limited your potential. This leads to sudden feelings of anger. You might grow annoyed with your wife, with your husband, in short, with your spouse. You might be angry with your aging parents. You might be angry with your closest friends for minor conflicts, for minor infractions. The other sign of midlife crisis is nostalgia. Instead of focusing on the positives of the present moment, you begin to idealize your past lifestyle. You reminisce about how beautiful you used to be, how handsome you used to be, how athletic you used to be, what great body you used to have. You reminisce about how you used to have a big social circle when you were younger. Those are signs of midlife crisis. The other symptom is impulsive and indulgent behavior. You start making big purchases, or you start drinking too much alcohol or consuming too much drugs to deal with the feelings of unhappiness, the feelings of unsatisfaction, the feelings of discontentment. There are people who, when they're going through midlife crisis, they start indulging more in food. They start eating too much. You see, obesity comes in. Overeating out of boredom or stress is a big sign of midlife crisis. So, all these behaviors don't completely satisfy you, but they have health consequences. Then there's the changes in sexual desire. There are people, when they're going through midlife crisis, they experience an increase in sexual desire, while others experience a decreased interest in sex. You might entertain thoughts of infidelity, or you might engage in infidelity when you have doubts about your current relationship. All those are challenges in midlife crisis. Thoughts of dating someone younger because you're getting old, or all those thoughts are related to your insecurities about aging. There is the changes in ambition. You suddenly feel very motivated to make changes to your life. You want to move to a new area. You want to buy a new house. You want to buy a new car. You want to get that big promotion at work. All these are attempts at correcting what you think are your past decisions. You feel less motivated to reach for these goals because you start questioning also the purpose of your life. Why are you in this world? What is your purpose? So, if you look at these symptoms, you can easily mistake them for symptoms of depression. But there's a difference between depression and midlife crisis. Now, let's quickly look at the difference between midlife crisis and depression. When you talk of depression, this is a diagnosable mood disorder with an established list of diagnostic criteria. Midlife crisis, on the other hand, it's not a recognized medical or psychiatric condition. In depression, symptoms can occur in people of any age. It can include teenagers, it can include adults. But with midlife crisis, it occurs in middle adulthood, mainly 40 to 60. Now, with depression, it's often caused by a combination of biological, psychological, and social factors. But for the midlife crisis, it's caused by a person's revaluation of their own life as they age. They start questioning their lifestyle, their decisions, their past decisions. They make comparisons. With depression, symptoms may be more persistent or they may be severe, but with midlife crisis, there's that sense of dissatisfaction which comes and goes through midlife. With depression, the treatment involves medication, it involves therapy, it involves lifestyle changes. But with midlife crisis, symptoms may subside when you regain a sense of peace in your life's direction, when you accept things the way they are. So what do you think are the causes of midlife crisis? Now, some of the causes of midlife crisis are related to cultural views. Not all cultures go parallel with the concept of midlife crisis. The Western society, for instance, tends to paint physical aging in a negative light while glorifying the youth. So, this has an impact in midlife crisis. There's that negativity around aging. It might make you feel a sense of despair or a drop of self-esteem as you reach midlife. You might feel compelled to reevaluate your progress in life, or you might find yourself viewing this midlife crisis period, all right, as simply a transition into old age. So the choice is all yours. Stressors, setbacks during adulthood can also crystallize or exacerbate or trigger what you think is midlife crisis. Stressors could involve changes to your physical health. Stressors could be social relationships, changes in social relationships. It could be changes in your career, finances. Physical changes also may impact how midlife crisis is to you. All right? For instance, conditions like high blood pressure. These physical changes can make you feel disheartened or fearful of the future. There's also menopause that women experience. Menopause comes with symptoms such as changes in mood, difficulty in sleeping. This may contribute to increasing stress. So, there's also the change in family dynamics. There's the change in your relationship with your parents. You start becoming the caretaker for your aging parents. It can be emotionally stressful. There's also the issue of divorce, which may contribute to a problem in your midlife. You see, it's not easy to separate from a long-time partner. It can bring about conflict emotions such as sadness, anger, confusion. And if you have children, divorce can also complicate your family dynamics. Many parents experience empty nest syndrome during the midlife crisis. That is a feeling of grief tied to their children moving out of the house. You experience loneliness or feelings of emptiness when the parents start reassessing their role as a parent, and they have to refocus on themselves now. So there's also the issue of career changes. There's the changes in financial situations. So, how can you get help for a midlife crisis? We've said that a midlife crisis can be very emotional, frustrating, and confusing. But there are things that you can do to help get through a midlife crisis period. You can seek professional help. You can see a doctor or therapist. All right? Therapy is a great way to talk about your feelings and emotions healthily and safely. There's the issue of couples counseling. So if you and your partner are experiencing midlife crisis symptoms, it can help to try couple counseling. A therapist can help mitigate challenges and give helpful tips on how to help your partner go through a midlife crisis. You can also try something new. Pick up a new hobby or get back into an old hobby that can bring you joy and excitement. It is a good thing, it is a good to think through issue, all right? Think about it well. Make your decisions carefully. Take your time as you deal with this midlife crisis. Pick an extreme hobby or do something too new to you that could be unhealthy or reckless, and that will bring you problems. It might make things problematic when you go the extreme way. So make sure you're very careful about what you do, the new hobbies you take, the new decisions you focus on. Take your time. If you're going through a midlife crisis that crisis, it is midlife crisis and not depression, just know that things will get better with time, because midlife crisis things will always get better. But it takes time to get through midlife crisis, all right? If you are not aware about it. So be patient, be kind, be understanding to others who may be going through midlife crisis. So accept change. Change is inevitable. The only thing that is constant in life is change. Make peace with that midlife crisis. Find satisfaction in that midlife crisis period. Accept it, love that period. When you do that, it will help you to adjust to changes and cultivate emotional resilience. Acknowledge your feelings. Suppressing your emotions can lead to unhealthy coping strategies, and it can increase stress. Instead of burying your feelings, find ways to process them. So whether you are feeling frustrated and confused by a divorce or stressed out by finances, consider writing down your feelings in a journal, for instance, in a diary, in a notebook. A trusted friend can also be useful as an outlet for your emotions. Identify and accept circumstances that are beyond your control. If you feel stressed by a situation, question whether there is anything you can do to change it. Accept your limitations and try to narrow your focus to things that are within your control. Instead of dwelling on the fact that, for instance, your children are becoming more independent and moving away from you or from your home, brainstorm ways that you can expand your social circle. Try to ease yourself into new situations. It is very easy to feel overwhelmed by big changes and new roles. So take time to map out the road ahead and break large challenges down into small steps. Maintain a sense of purpose. There are situations like divorce, like job loss, or empty nests. They can leave you searching for a sense of purpose when you get to the middle age. So it might be tempting to conclude that your best years are behind you. However, that sentiment doesn't have to be true. Try out something new. Experiment with a new hobby. For instance, photography, cooking, creative writing, dancing. Challenge yourself with maybe even learning some foreign language. Try to learn some French, some German, Portuguese, Spanish. Try to learn how to play a guitar, how to sing. So doing so will help you, or will help your brain become sharp. Expand your social circle. Give your life a new purpose. Don't limit yourself to skill building experiences. Explore new places. That can also be fulfilling use of your time. You can visit local parks. You can go for long trips. You can to places you've never been to. Engage in old interests also. Take time to reflect on past interests and hobbies that you neglected. If you're an actor, you can go back to acting, maybe painting, maybe drawing, singing, dancing, and all those, playing sports. It's a good way to build a sense of purpose. It's a good way to boost your self-esteem. It's a good way to meet new friends. Embrace community activities. Volunteer. It gives your life meaning. It increases happiness. It improves your mental health when you get into midlife. Prioritize self-care. Set realistic exercise goals. Work out. The benefits of exercising is that it sharpens cognitive functioning. It reduces risk of anxiety and depression. It improves sleeps. It helps in weight loss or management. It slows the loss of bone density. It strengthens muscles. Reassess your diet. Get enough sleep. When you talk of good sleep, we mean 7 to 9 hours of sleep each night. Adjust your perception of midlife and aging. Practice gratitude. That is, thank you. Be appreciative of everything that you have. Make a list of what you're thankful for. If both your parents are alive, be thankful for your parents' longevity, for your children's growth, for your stable job, for your financial independence, for your good health. Look towards your accomplishments. Look at what you've overcome. Look at what you've achieved. What is the positive effect you've had on others? What are the wise decisions you've made? What are the actions you've taken? Don't focus on your regrets. Ask yourself, how have I grown? Reframe setbacks as opportunities for growth. You can also help someone who's going through a midlife crisis by listening without judging them, by being receptive to potential changes in your relationship, by keeping an eye out for signs of depression. We say that midlife and depression have some common symptoms, including difficulty in concentrating, insomnia, irritability, reckless behavior. So if these symptoms are persistent and they show up every day, then it's more likely to be depression. Spend more time together.